Start with the bumps. Doctors call them xanthelasma, small, yellowish, slightly raised patches that form on or around the eyelids, usually near the inner corner close to the nose. They were first formally described in Western medical literature in the 1800s, but the pattern itself, fatty deposits collecting under thin eyelid skin, had been informally noted by physicians for far longer, because eyelid skin is some of the thinnest skin on the human body, sometimes less than half a millimeter thick, which makes it an almost transparent window into what's floating in your bloodstream. Here's the mechanism. Those bumps are made of cholesterol, specifically lipids that have leaked out of tiny blood vessels and settled just under the surface. A landmark Danish study following over 12,000 people for up to 33 years found that people with xanthelasma had a significantly higher long-term risk of heart attack, independent of their cholesterol numbers on paper. Think about that for a second. A bump you'd dismiss as a skin thing was outperforming some blood tests at predicting cardiovascular risk. Here's the thing nobody tells you. You don't need high cholesterol to get them, and you don't need to feel unwell. The eyelid was just the first place thin enough to show the leak. Then there are your nails, and specifically a condition called Koilonychia, spoon nails. Instead of curving outward like a healthy nail, the nail plate dips inward, so much that in advanced cases you could genuinely balance a drop of water on top of it, the way you balance one in the bowl of a spoon. This was documented extensively by hematologists working in the early to mid-20th century, treating populations with severe iron deficiency anemia, particularly in post-war Britain, where food rationing had quietly stripped iron out of millions of diets without anyone realizing it until nails started curling. The mechanism is almost mechanical. Iron is essential for producing hemoglobin, but it's also critical for the enzymes involved in nail matrix growth. Starve that matrix of iron long enough, and the nail literally grows in the wrong shape, softening and flattening until gravity and pressure bend it inward. Here's where it gets interesting. Koilonychia doesn't just show up with anemia. It's been linked to thyroid disorders and even certain occupational exposures, like long-term contact with petroleum-based solvents, which was first noticed among mechanics and factory workers whose nails were spooning years before their blood work caught anything. Move to the corners of your mouth. Cracks there, angular cheilitis, sound like nothing more than chapped lips gone slightly too far. But they're one of the oldest documented signs of vitamin deficiency in clinical history, described in nutritional surveys from the early 1900s among populations dealing with pellagra and riboflavin deficiency. The mechanism is simple biology. The corners of your mouth fold and refold constantly, trapping saliva, and that moist, warm crease becomes a breeding ground for yeast and bacteria the moment your body's tissue repair resources, largely B vitamins and iron, run low. Healthy tissue heals the micro tears from talking, chewing, and smiling almost instantly. Deficient tissue can't keep up, and the cracks deepen and linger. Now look at the ring. Around the outer edge of the iris, some people develop a pale gray or white band called Arcus senilis, or when it shows up in someone under 40, Arcus juvenilis. And that age distinction matters enormously. In people over 60, ophthalmologists have long treated this ring as a fairly unremarkable part of aging, cholesterol slowly depositing at the edge of the cornea the way limescale builds up in an old kettle. But when researchers, including teams publishing through the American Heart Association in the 2010s, started tracking the same ring in people under 45, they found something else entirely. A strong correlation with elevated LDL cholesterol and significantly increased cardiovascular risk, essentially decades ahead of any chest pain. Then there's your tongue. A thick white coating across the surface, sometimes described as looking like cottage cheese, is most commonly oral candidiasis, an overgrowth of the yeast Candida albicans, a fungus that lives harmlessly in almost everyone's mouth in small amounts. Dentists and physicians have tracked spikes in this condition among 3 very different populations: people using inhaled corticosteroids for asthma without rinsing afterward, people with poorly controlled diabetes, and people with weakened immune systems, including patients undergoing chemotherapy. The mechanism ties all 3 together. Candida thrives on sugar and struggles against a healthy immune response. So anything that either raises the sugar available in saliva or suppresses the immune system's defenses can allow Candida to spread. Ability to keep yeast populations in check lets it bloom across the tongue's surface almost like algae taking over a still pond. Here's what nobody tells you about that white coating. Dermatologists estimate a meaningful share of adult-onset, persistent cases are the very first visible clue that leads to an undiagnosed diabetes diagnosis, discovered not through a blood sugar complaint, but through a dental exam. Now think about your eyebrows, specifically the outer third, the tail end, nearest your ears. Thinning or complete loss there has a name clinicians still use today, the Hertoghe sign, credited to Belgian physician Eugène Hertoghe, who spent much of his career in the late 1800s and early 1900s studying thyroid disease before modern hormone testing existed, relying almost entirely on physical observation like this to diagnose patients other doctors dismissed as simply tired or aging. The mechanism connects directly to thyroid hormone's role in hair follicle cycling. Eyebrow hair, unlike scalp hair, has an unusually short growth phase, which means it's one of the first places in the body to show the effects when thyroid hormone drops, well before fatigue, weight change, or cold intolerance become obvious enough to complain about. Here's the thing. Hertoghe made this connection using nothing but his eyes and a notebook, decades before anyone could measure TSH levels in a lab, and modern endocrinology has never disproven him. Look at the neck now, at the base of the skull or the folds of skin there, a darkened, velvety patch called Acanthosis nigricans, often mistaken for dirt that won't wash off. It was documented by dermatologists as far back as the 1890s, but it exploded in clinical relevance over the last few decades as rates of insulin resistance climbed globally. The mechanism is almost architectural. Chronically elevated insulin levels bind to receptors on skin cells and stimulate them to overproduce, thickening the skin and darkening it through excess pigment production, concentrated in the folds and creases where skin is thinnest and rubs against itself most. A 2019 review estimated the condition appears in a substantial share of children who go on to be diagnosed with type 2 diabetes, sometimes years before a single blood test flags anything abnormal. You've seen this pattern by now. A visible external clue tracking an invisible internal hormone problem, showing up on skin because skin is simply where the body has the most surface area to display what's happening underneath. Consider a wound that just won't close, a small cut on the foot, a blister that should heal in a week, still open a month later. The mechanism is almost architectural. Chronically elevated insulin levels bind to receptors on skin cells and stimulate them to overproduce, thickening the skin and darkening it through excess pigment production, concentrated in the folds and creases where skin is thinnest and rubs against itself most. A 2019 review estimated the condition appears in a substantial share of children who go on to be diagnosed with type 2 diabetes, sometimes years before a single blood test flags anything abnormal. You've seen this pattern by now, a visible external clue, tracking an invisible internal hormone problem, showing up on skin because skin is simply where the body has the most surface area to display what's happening underneath. Consider a wound that just won't close, a small cut on the foot, a blister that should heal in a week, still open a month later. Slow wound healing has been one of the clearest markers of poorly controlled diabetes since insulin therapy first became available in the 1920s, when physicians noticed diabetic patients healing at roughly half the rate of non-diabetic patients undergoing similar minor injuries. The mechanism is circulatory and cellular at once. High blood sugar damages small blood vessels over time, restricting the flow of oxygen and immune cells to injured tissue, while simultaneously impairing the white blood cells that are supposed to fight off infection at the wound site. It's your body's repair crew showing up understaffed and underfed. Here's where it connects back. This is the same vascular damage responsible for that eyelid cholesterol leak and that thinning corneal ring, just expressed somewhere else on the map. Cold hands and feet, even in a warm room, are so common, most people never think to mention them to a doctor. But persistently cold extremities can point to a thyroid running too slow to properly regulate metabolic heat production, to poor circulation from narrowed blood vessels, or in more dramatic cases to Raynaud's phenomenon, first described by French physician Maurice Raynaud in 1862 after he noticed a pattern of patients whose fingers turned white, then blue, then red in response to cold or stress, caused by blood vessels in the extremities overreacting and clamping shut. The mechanism, in the more common cases, comes back to the same thyroid story as those thinning eyebrows. A slower metabolism means less internal heat generation, and the body prioritizes protecting the core, sacrificing blood flow to the hands and feet first, the way a struggling power grid cuts electricity to the outskirts before it touches the city center. Unexplained bruising, bruises that show up without any memory of an injury, gets waved off as clumsiness more often than almost any sign on this list. But hematologists watch for it closely because bruising is essentially a leak report from your blood vessels and platelets. Vitamin C deficiency, extensively documented in 18th century naval history among sailors developing scurvy on months-long voyages without fresh produce, causes bruising because vitamin C is essential for producing collagen, the structural protein that keeps blood vessel walls intact. No collagen, no wall integrity, and blood leaks into surrounding tissue from the smallest bump. In other cases, unexplained bruising points to platelet disorders or blood-thinning medication interactions doctors need to know about immediately. The mechanism differs by cause, but the visible result is identical: your skin turning into a bulletin board for problems happening at the vessel level, invisible until the leak breaks the surface. Now the fingertips, specifically clubbing, where the ends of the fingers become rounded and bulbous, and the nail curves sharply downward over the tip like the back of a spoon, flipped the opposite direction from Koilonychia. Hippocrates described this over 2,000 years ago in patients with what we now recognize as advanced lung disease, and it's remained clinically relevant ever since, associated with chronic low-oxygen conditions, including lung cancer, cystic fibrosis, and congenital heart defects. The mechanism is still debated in its finer details, but the leading explanation involves platelet clumps that would normally get filtered out by healthy lung capillaries, instead passing through damaged ones and releasing growth factors that stimulate soft tissue and blood vessel growth at the fingertips, swelling them over months or years. Here's the thing: clubbing develops so gradually that patients almost never notice it themselves. It's almost always caught by someone else, a doctor pressing two fingertips together and looking for the diamond-shaped gap at the base of the nail that should be there and suddenly isn't. Yellow in the whites of your eyes is one of the least subtle signs on this list, and also one of the oldest recorded, with descriptions of jaundice appearing in medical texts from ancient Mesopotamia. The mechanism is a backup in the body's waste disposal system. Red blood cells break down constantly and release a yellow pigment called bilirubin, which your liver is supposed to process and clear through bile. When the liver is damaged, blocked, or overwhelmed by hepatitis, gallstones, or excessive alcohol use, bilirubin builds up in the bloodstream and stains tissue yellow, and the whites of the eyes, technically called the sclera, show it first and most obviously because that white tissue is unusually good at absorbing and displaying the pigment, the same way a white shirt shows a coffee stain that a patterned one would hide. Pale inner eyelids sound almost too minor to matter, but pulling down the lower eyelid to check the color of the inner membrane, called the conjunctiva, has been a bedside anemia test for over a century, still taught in medical schools today, specifically because it requires no equipment at all. The mechanism is straightforward. That membrane is thin and densely packed with tiny blood vessels, so its color depends almost entirely on how much hemoglobin is circulating through them. Rich red-pink means healthy iron levels. Pale pink or nearly white means the blood is running low on the protein that carries oxygen, the same iron shortfall responsible for those spoon-shaped nails, just visible in a completely different location because the body is running out of the same resource everywhere at once. Ridges running horizontally across the nail, deep enough to catch a fingernail running over them, are called Beau's lines, named after French physician Joseph-Honoré Simon Beau, who first described them in the 1840s after noticing they appeared in patients recovering from severe fevers and illness. The mechanism is almost like tree rings recording a drought. Nail growth temporarily halts during a major physical stress event, a serious infection, extreme malnutrition, even chemotherapy, and when growth resumes afterward, it leaves a visible groove marking exactly where the interruption happened, slowly traveling toward the fingertip over the following months as the nail grows out, giving doctors a rough timeline of when the stress occurred just by measuring the ridge's distance from the cuticle.